Something to think about. Maybe we have it.
Do you want to just do a quick check-in to see who's here today before we go into the presentation?
Yeah, persons can go ahead and introduce themselves.
I think we can shoot straight into the presentation and just connect with the committee members after the conclusion of Ms. Bryant's presentation. I'm not sure exactly what her schedule allows for, and we definitely don't want to keep her too long.
Okay, sounds good.
Alrighty. Do you need co-host privileges, Ms. Bryant?
Yes, please. I have a presentation in this.
Perfect. I'll give it to you momentarily. You should be good to go.
Good evening, everyone. My name is Alicia Bryant. I am the program director for the New York Connects program that is run out of Brooklyn. We are fully funded by the Department for the Aging and New York City Aging. So we provide services to older adults and individuals with disabilities. Individuals with disabilities across the lifespan. All right, so my few topics that I'm going to go over is what New York Connects is, the populations we serve, services and supports we provide, and benefits and programs. And then we can talk about how we can work together to support our Brooklyn community. So what New York Connects is, like I said, we're a Department for the Aging funded program supported by New York City Aging. Each county across the state has a New York Connects program, so that also includes all 5 boroughs. So there is a New York Connects in the Bronx, Manhattan, Staten Island, and Queens, and each has their own staff and program director. We provide telephonic support, light case management, home visits for homebound individuals, and resources and referrals to communities in need. All the services we provide are free, unbiased, objective, conflict-free, and we provide resources to our community members regardless of income level and ability to pay. We also provide options counseling, which basically, oftentimes when people call us, they're in crisis. And so we support them in being able to kind of compartmentalize a problem and help tailor the solution based on their current situation and what services and benefits are available to kind of help them navigate whatever that is. We are a team of social workers. I'm a licensed master social worker. I have another licensed master social worker that works with me. And then I have 4 other BSW level Bachelor of Social Work staff members. And everything that we do is person-centered and strength-based. So whenever we're trying to work with a community member, we always try to ask them, like, what has been working? What have you been doing that's been successful? And, what has changed in your situation that you're now seeking assistance? Because sometimes some of the things that they have done previously may still be feasible options, but we just have to kind of support them and being able to continue to thrive and live in the community. And who we serve: older adults, individuals with disabilities across the lifespan, which is from childhood to adulthood, family members and caregivers of said populations, friends or neighbors, and professionals who may interface with any of these populations. We provide an array of resources with an emphasis on aging in place. I kind of like to think of us as almost like 311, but like on steroids, just because we do provide that case management aspect and we do home visits. But people often call us because they're experiencing some sort of challenge in their life. And so we just kind of help support them, provide them resources. We try to do warm handoffs whenever possible to make sure that they get connected to the person that they need to speak to, versus just giving them like a phone number or email address and telling them just reach out to this person. We provide support in getting connected to long-term supports and services centered around independent living. And we aim to provide community-based support to our target populations with a holistic approach. So getting people connected to resources and community-based organizations that are local, because, you know, as we age, or, you know, individuals who have disabilities may not be able to travel very far. And so making sure that whatever services we provide are already embedded in the community in which they live. We connect, I have to change this, but we connect individuals to needed respite care, increase access to food, healthcare, shelter, and social supports. Sorry. Assist individuals with obtaining legal services, educating community members, and supporting them through various life challenges, advocating and intervening when, advocating and intervening when a community member demonstrates a higher level of need, and care coordination after long-term stays in hospitals or nursing. We also support people in getting access to public assistance benefits, supporting community members in navigating housing issues, accessing home care services, facilitating communication between community members and case managers if they have one, providing strategic and targeted support for community members in crisis, navigating various city and state agencies, that could include HRA, DSS, DHS, OPWVV, getting them connected to their city council rep if there's anything that their office can support them in with, in facilitating. And we also conduct outreach and public events to highlight benefits available to our community members, which is why I'm here talking to all of you. And in order to get in contact with us, individuals can call the program directly Monday from 9 a.m. to 7 p.m. and Tuesday through Friday from 9 a.m. to 5 p.m. Our phone number is here. And we also do drop-in and appointment services at our office at 1655 Flatbush Avenue. It's across the street from the Target in the Philip Howard building. It has a large fountain outside. It's very nice. And the office is open Monday through Thursday, 9 a.m. to 5 p.m. and Fridays by appointment only. We can also be reached by email, newyorkconnects@pssusa.org. And we also have an online referral form that if there's anyone that you know that may benefit from some additional resources or support, you can scan the QR code and then it'll walk you through. Just choose which option, if it's like a self-referral or if you're referring someone else, you can indicate that. And if they have, if you have their consent to, you know, reach out to us on their behalf, those types of questions. And yeah, that's basically all I have.
Thank
Is that
you.
the end of the, okay. If I may, I just want to ask a question. Do you go to shelters to do presentations to them as to the services that you offer? Or when I say and also senior citizens, especially the senior citizen shelters, centers.
Yeah, so we have partnered with some senior centers. Tomorrow, one of my staff is going to St. Nick's Alliance and conducting a presentation there on elder abuse. One
Right.
of my staff has gone and done presentations on self-care for older adults.
Okay,
And
so
so, go ahead, I'm sorry.
go ahead. Sorry, I disturbed you. Sorry.
Basically what we try to do is figure out like what are themes that are coming up for the older adults at whatever the location is, and then we create a presentation tailored towards addressing whatever the presenting need is at that place.
Okay. So, what I would really like to do, because you already have my contact information, I would like to connect with you because I usually go to quite a few of the senior centers to do what I already do with them is more or less letting them know what their rights are in their homes where they live, their accommodation rights in housing, and disability rights, the accommodations that they need. But sometimes they do ask questions relating to the presentation that you just did, and I usually say to them that I will get back to them. So I'm very thankful that you are here giving this presentation tonight. So since you have my email address, I just would like you to send me um, an email, just letting me know that this is who you are, and then I will be able to communicate with you. I'll be able to have a one-on-one with you, as to because I'm going to many of the Fort Greene Council senior centers, and then I have quite a few of them that I go to. So I would really like to partner with you, and then so you could do some presentation there.
Thank you for inviting me and inviting us, rather to do that because
Yeah, I'm hosting
that
next
is,
week.
I'm sorry. Go ahead.
No, go ahead.
No, that is one of the things like, we try to go on site to different places and, do triage, and because some of the sites don't have social workers on staff. And so we try to go there and target, especially those places that have need, to make sure that community members are connected to the resources and supports that they need. So I would really love that. Thank you.
Yes, I have partnered with Fort Greene Council, and I think they have about 18 different locations. And yesterday I went to Hart Street, and the director over there asked me to come in on a monthly basis, which is much for me. I will not be able to go there on a monthly basis, but the next time that I'm going, I would like you to be present. And also, they have another location on Rogers Avenue at 19 Rogers Avenue that they would like me to come back. And I have another 2 locations that I have to go to. So I will, if you maybe tomorrow you can send me an email and your contact number, I can call you, and then we can have a little bit further dialogue and as to how we could partner to bring the much needed information to the seniors and these places.
I will send you that email as soon as I get off of Zoom with you all. Thank you.
You're very welcome. I'm so sorry. As I said, I'm on the road, and that I'm speaking. I don't. Whenever I have a meeting, I like persons to see my face because I like to, I like to see persons' face. So I apologize for everybody who's on. You know that I'm always on and I always have my camera. So I apologize. And then I'll turn it over to my co-chair as she continues to lead out in the meeting. Thank you so much for coming. And then I'm looking forward to getting an email and we'll be able to correspond further.
Oh, thank you, Elisa, for your presentation. I was going to ask a question, and then if anyone else wants to ask a question, you can also unmute yourself. But I just wanted to know for the program, is there any eligibility requirements, like in terms of age, and also someone's immigration status? Like, can someone who's undocumented qualify for the program?
Yeah, so we provide support to older adults, which would be 60 and up, and then individuals with disabilities across the lifespan. So it could be children, young adults, older adults. And no, there is no documentation, citizenship status requirement or anything. Individuals honestly don't even have to tell us anything personal. Like, they don't have to give us their name, their address, phone number. If they don't want to, they can receive services and resources anonymously if they so choose. So there's no need to even disclose. We would never ask you, like, are you a citizen or anything like that, unless it's something that they need to disclose to us in order for us to know how best to, support them through whatever it is that they're going through. But there's no personally identifiable information necessary.
Okay. That's great.
I just want to disclose that when persons are looking for services or anything, it is against the law to ask them about the immigration status. So just want to put it out there. So whatever services persons are getting, could be housing or whatever it is, no one should ask them about the immigration status.
Thank you.
Can I ask a question? Do you have like a one pager that shows all your services? That's number one. Also, I came in a little bit late, but you're located throughout New York City. You have one program or several, depending on the borough.
So there is a New York Connects. Okay, your first question. Yes, I do have a one pager. I will email it to you all. And the answer to your second question, there is a New York Connects program in each borough and in each county across the state. So if you're upstate in Hudson Valley, there's a New York Connects program up there as well. It's just that I only oversee the program that services Brooklyn. So then each other location would have to be contacted in their respective counties.
Okay, and you just to reiterate, you said your demographics are 60 and up in general, seniors 60 and up, and anybody with a disability like 0 and up.
Absolutely.
Okay, thank you.
Of course. Any other questions?
Yeah, I did have a question. So I think I got it from your presentation, but it's not your organization. It doesn't provide like long-term ongoing supports. It's more like bridge, like linkages, or like solving like immediate issues, right?
Yeah, unfortunately, we don't have the capacity to do long-term case management because we are a small staff. But we will provide people connections with long-term case management if that's what they determine, that the need is.
Okay. All right. Thank you.
Right.
You're under Department of Aging?
Yes,
New York
so
City?
it's funded by the Department of Aging, yeah.
Okay, and where are you located in Brooklyn? You said, is it Kings High, Flatbush?
1655 Flatbush Avenue, right across the street from the Target on the junction.
Okay. Oh, right near where Fran's event's gonna be. I think she's doing an event in a little while over there.
You guys are in the co-op building, right? The Philip Howard Co-op building?
Yep, we're located in the basement.
Okay,
the
gotcha.
If nobody else has any questions, I will bid you all farewell. But thank you so much for having me. And I look forward to meeting you all again one day.
Thank you. Thank you for joining us.
Thank you.
Have a
Thank
wonderful
you.
evening.
Good night. Thank you. Thank you.
Okay. All right, moving along. The next item that we have is Downstate Hospital. Is that an update from Francesca? Do you have this update or?
So we are still in discussion. Let me see if I can. I'm in the car. I'm still in discussion with Downstate. You're still in discussion, as many of you would have seen, and I don't know who would have been present at last week's Thursday's demonstration, and there are still many coming together meetings behind the scene, online, in person, and they're still in discussion because as anything else, I mean, the community, they don't want the hospital closed. The staff members, they don't want the hospital to close because if the hospital should close, it's going to be a hardship when it comes to person's health in the community. Many of you know that you have friends and families, and even some of you would have complained when you go to Kings County and the length of time that you have to wait for service. Since it got worse after Kingsbrook Jewish Hospital shut down because the majority of the patients from Kingsbrook, that was directed to Interfaith, and some of them, they sent them over to Brookdale, and commuting was kind of hard on many of the patients. So the majority of them, I would say more or less like 80%, went to Kings County. And some patients did go to Brookdale, Downstate as well. But so seeing the length of time, sometimes you have persons who go to Kings County and they are admitted and they will stay in the ED for 3 days before they can find a bed to move them upstairs. So if Downstate should close down, so you know what's gonna happen. So persons will spend almost a week downstairs, and the length of time that they would wait to see a physician, then I don't know exactly how persons would react to that. Because when you are sick, you're sick. You want to see a doctor. At the end of the day, where we are now, or where Downstate is now, they shouldn't have been in that situation because 2013, the writing was on the wall. They kind of took an eraser and erased part of it, but the smudges were still there, and it came back up again, and nothing happened. So right now, whatever monies that they are looking to give Kings County to expand, Kings County don't have the capacity to do that right now, and we are thinking of persons in the community. We are thinking of the staff, and they are thinking that whatever monies that they have later on, they would be using the money to change the garage they have on Lennox at the back of the hospital to change it into ambulatory care. They have all they have the dialysis unit there, which council member Eugene got it for them, funded it for a reason. A lot of our dialysis patients, they had to go to Kingstown in Manhattan, right, to receive service. And hence, because of that, he makes sure that he bought this top of the line machine and set up everything for them. So we don't know what's going to happen, really. They're still meeting. It's not something that's going to happen overnight. They're still reaching out to the governor, Senator Myrie, because we have, I think there are about 3 specialties at Downstate Hospital, which Kings County does not carry. So if Downstate had to close down, then Kings County would then have to pick up these specialties and have to have wings for the specialty, the dialysis, and there are 2 others that I can't remember off the top of my head. So it is a no-no, and we are rallying everyone. I know H and the H, they really want us to really work with them, to stay at the table with them, to really get get things going. We don't know where it's going from there, but hopefully, just hopefully, we can get some answers. Maybe by the maybe in the next month or so, we can see some light at the tunnel. We don't know how bright the light will be, but we are hoping. We are hoping that we see some light at the end of the tunnel. Really and truly, we need people in the community to come out. We need persons to call the governor's office. We need when they had a rally last week, Friday, we were expecting like the whole of Claxton Avenue would have been full with persons. And it wasn't like that at all. The majority of persons who were out there were nurses, medical persons who were out there. And we're expecting more people from the community would have come out to support, but that didn't happen. So we really want persons to come out and really let the governor and everybody as leadership of the hospital know that we want Downstate to remain open. It has nothing to do with the patients at the hospital. It has nothing to do with the staff at the hospital. It is because of the negligence, you know. And when COVID came, they had Downstate operating just as a COVID center, and that was it. And that's a no.
Francesca, we lost you.
And you can see as to how many hospitals have been shut down in Brooklyn, in our community, you know. And then we have just Downstate, Brookdale, Kings County, that is in close proximity to for instance, in East Flatbush, I would say East New York, Bed-Stuy, and we cannot afford to lose another hospital. So when you hear of the coming together, the demonstration, whatever that will be happening, please come out and support, because we really need your support. We really, really need your support. Anybody has any questions, any comments, or anything to say?
Do you know when the next one will be? Because I didn't, I mean, I didn't see, I missed it, right? But I didn't see a lot of like publicity surrounding it either.
Yeah, it was after the on the news, really, after the demonstration, because it was really word of mouth that was going around concerning the demonstration that they were gonna have. So it was after the demonstration really they had it on the news. But before then they didn't really put it out there to, you know, asking persons to come. And you know, it was kind of really disappointing seeing the turnout, but as you say, people didn't know, you know.
I'll call you in a few minutes. I'm on a meeting. I'll call you back soon.
And when you look at it, regardless of what it is, we need the hospital because Kings County is oversaturated, and we really need these hospitals to fix. So the governor has to do something. They have to come up with some plan or the other, because we cannot afford to lose Downstate Hospital. Because really they are looking to close down the hospital where the medical center is right now. What they're looking to do is to have, I think, housing and training center and whatever. And to the back of the hospital, as I say, there they would like, that's where they want to put the ambulatory care. We want a full facility in the community.
Okay, thank you, Francesca. I just have a comment. I too, it's similar to Justin's question, but it's just more of a comment. Like, I don't feel like a lot of people know about this in the community, about at least the hospital closing, and then of any ways to support against the closure or reduction of services.
Recording in progress.
Yeah. I know I did see a commercial on YouTube. So YouTube had an advertisement against the hospital closing. I just wonder how many people really know about this, and also wondering like how we can, as a committee, show up to support. or rally?
Yeah, that's what I wanted to ask. What can we do?
Francesca, there's a link on CB9. The CB9 has a link that Mia sent me. Can we make sure that that link is sent out to everybody on this call and that have come to this committee? They should share with their friends as well.
There's a survey that's been circulated around the community. The initial rally was organized by State Senator Zelnor Myrie, who's been very vocal about his disapproval for any proposed changes at downstate. So I believe that we will be trying to organize efforts with Community Board 17 and perhaps do something and try to organize the community and perhaps create an event that we would gladly share with the committee and hope that you would share that with others and perhaps put together a one pager that we can circulate to the community just to draw awareness about, even those who don't utilize downstate specifically, the effects of the next door neighbor of Kings County, how that would greatly affect wait times and level of service and care.
But another thing that I think why a lot of persons, especially staff members, because I usually every month I usually have a one-on-one with the CEO at Kings County, and then he said, "Hey, did you hear this thing? They're looking to shut down downstate." I said, "What are you talking about?" And then later in the evening, then someone called me and said to me, a worker who works there said, "Could you imagine?" They said nothing to us, nothing whatsoever. All they did was to put up a posting. They didn't have no dialogue, nothing with the staff. And at the end of the day, when you look at our community, I think that I personally, it is my feeling, I think that it's a disservice to us and disrespect to us, because other neighborhoods, they would have a town hall, they would call and say, "Hey, this is what we're experiencing. We're having financial issues," because when they look at the condition of the hospital, renovating the hospital and just revamping everything in the hospital is going to cost them such amount of money, and they're not looking. I mean, bring the communities together, because the hospital is in the community and serving the community for so many years. And as I said, the specialties that they are offering, other hospitals in our neighborhood, they are not offering those specialties. We had persons going down to Manhattan and they have to wait for access to ride, and it's a long commute. And when persons go out to do the dialysis, and when they're coming back, they're tired, and it's a long commute for them. And so persons are happy to go there, and then they have other specialties that they're offering as well. And they did not have the respect for the community, nor did they have the respect for the staff to come in. So the community members, as well as the staff, they heard it just like you and I. They heard it from somebody or through the news media, So we know that the state, they have that type of attitude when they're going in the community, and they just feel, well, they just come and they just do whatever they want in the community, and they feel that they have to ask no questions, they don't have to ask permission, they don't have to say a word, they just do what they want, And if all of us have to sit down, and it does not affect the Black and brown community, it affects all of us. Every person who resides in the community, it affects each and every one of us, right? And I mean, even when Kingsbrook shut down, we were like, what's going on? We didn't know that Kingsbrook was shutting down. We just heard, okay, the emergency side is shutting. Then we heard this side. And I love going to Kingsbrook Jewish Hospital. I love to go there. And so I was so disappointed when, the place was shut down, but the community I don't think the community had no say. And I mean, if it was a place where it was a money issue, that's what we have all our elected officials there for. The constituents who vote for them, that's where they go and get service. So they would have gone to Kingsbrook, Downstate, Brookdale, Kings County, right? Now, when you look at that, Kings County is city, right? The other hospitals, they are more or less private hospitals, right? So now you have Downstate, you have Brookdale Hospital and One Brooklyn Health, and then we are just wondering, what is happening there. So if we lose Brookdale Hospital, what happened? Persons were like, persons to say, hey, person that just fall on the side of the street and just die. You're gonna take persons who from here and take them all the way to Manhattan, down Kings Highway, or take them to Queens. So we all have to come, and each person here, we represent an organization. We know people, and we need to come together, because most of the time what we do, we do a lot of talking, but when it comes to action, we just sit back and we expect persons to take action first. We need to come out. Each one of us have a voice, and we have other persons that we're connected with, and each one of them have a voice, and then they're connected, and we can all come together and say, hey, no, this ain't happening. Not here, it's not happening. And we have to stand up. We should not just sit and talk, but we should mobilize, organize, and come out and stand up.
On that note, thank you, Fran. Mia, is it possible to send that survey out during your Friday afternoon blast, maybe at the top of the page?
Yes, Orna, we can definitely move it up. It is there now, but we'll move it up.
Sounds good. And Fran, do you think there'll be another rally? Like, I mean,
yes,
I think
they will have more rallies coming up, sure.
Because I know the window's not too, it's very short. I heard like she wants to make the budget close in April, maybe at the beginning, which gives us very little time.
Yeah, it's ridiculous. I didn't think that she would have done us like this. And I mean, she's coming there now, and it is an issue. It is a sore that they had, and the sore just started getting worse, and it just started getting worse, and just started getting worse. Because I mean, since 2013, there was a write-up and everything about it. The state, they spoke about it. So I mean, leadership did nothing. I'm just like, and we had a meeting, and he made no sense, absolutely no sense in what questions they were asking. He couldn't answer this question. All he was saying, oh, well, we're going to expand at Kings County, and then we will send X amount of beds at Kings County, and some of the other staff will go at Mamamades. Who told them the people want to go all the way down there? And then when you have family members who have to come to see you, and they have to find their way all the way down there. So some of the staff will go to Mamamades, and then we'll send up based on the person's condition, we'll send them down there. But the greater percentage of the patients, they'll be going to Kings County, and we'll begin. Kings County was looking to expand. Kings County was looking to expand the ED, because the Kings County ED is small. And then we want to accommodate persons. They want to, when persons are coming to get them out, and persons start sitting down there for 4 hours waiting, and they've been pushing. And it's just getting worse. So we have to fight it. We have to fight it.
That could be a lot of duress on the staff as well. I mean, having all that pressure. And that's not a good situation.
Yeah. A lot. But let's see what happens.
So everybody, I guess we're going to get that survey in Friday's blast. It comes very late on a Friday. We could share that out with our networks.
Yeah,
definitely. I'll be sending it, emailing it to the committee in a few moments.
Oh, great. Thank you.
Sure, not a problem.
Do you know if the flyer or one pager will be available as a hard copy to just distribute to those who probably don't have, who might not?
It's actually not completed. I'm gonna connect with Dante tomorrow to see if we can get it together and get it out to the community, just so that it's bullet point, basic layman terms, so people understand what is happening.
Okay.
Yeah. And as soon as that's done, I'll get it out to you guys.
Yeah. Anything else on the agenda, Darian?
Can I make a short announcement, Francesca?
Sure.
We're having a spring, I'm with Connect IDCC, similar to NY Connects, which I found very interesting. We're having our spring resource fair on March 28th. That's a Thursday at our office. We're collaborating with Diaspora Community Services. We're going to be giving out produce, hopefully some clothing, and a lot of information from different agencies. So please come by. That's from 11 to 3 at our office, 921 East New York Avenue. And we do have walk-in services. If you walk in, we did tabling the other day, and I had several people walk in for counseling, for food, for help with benefits. So we actually have walk-in services as well for everything that we do, which also includes housing issues.
Did
Thank
you
you.
send a flyer to Mia?
I'm gonna send it tomorrow for the blast.
Okay.
I could send it in the morning as well. Maybe I'm gonna see if I can
Arna?
pull it up.
What are the times? It's March 28th from what?
Yes. So it's 11 till 3.
Okay, thank you.
Trying to find it. If I can get it here, I will. I'll send it to me as soon as I can find it on my email.
We have a Brittany Ellington. Is she part of the committee or is she just a community member? Well, I mean, I don't mean a community member, but just visiting.
Hi, all. I'm a community member. I usually watch live actually on Facebook and decided that I'll start joining the Zooms. So yeah, I'm a community member. I live in CB9, born and raised in Crown Heights on Utica side.
Wonderful. It's just great to see you. It feels better being here instead of watching on Facebook.
Yes.
You're able to participate.
Exactly, yes. Thank
Yeah.
you.
You're so welcome. So welcome and hoping to see you next month.
Yes, for sure.
Yeah, so I'm assuming that you'll get the information so you could join and have other persons to join, because we want to hear from the community and let the community come out, because persons are out there, they see the needs and just bring it back to the committee, and then so that we can do much, especially when it comes to healthcare and whatever needs, especially my heart goes out to the seniors, and so whatever we can do to help Anna and her committee, and they're doing a great work, out there, and I know other persons here, they're doing much work out there. So, and there is much more that needs to be done. And I'm just looking forward to us, all collaborating together, not just one person or an organization working independently, but we all come together, and together we'll be more powerful, we'll be stronger, we'll be able to do much more for our community. So let's just stay together and work together. If you have you hear something is happening, just reach out to the board office, because the board office is so good at anyone who send any information, who asks a question or they need to reach me. As soon as you pass it on to them, they pass it on to me right away, and it's not delayed. So, if you see a need somewhere, for a senior, it could be a senior center, it could be an individual, it could be a shelter, whatever it is, the need is, and when it falls under health and social services, come together, just come with an idea and say, hey, why don't we do this? Let's do this, and let's come together and really make it happen. That's what it's all about. It's about community and it's about us. It's not a CB9 thing or Leopold thing. It's just a we thing, a community thing. And the more we collaborate together and talk and see how best we can improve life for our brothers and sisters in the community, is the better our community will be. Since if you permit me, and Dorian, I'd just like to touch on the mental health forum. We're still at the table. We are still discussing. We were looking at May 31st. I totally missed it because May 31st I'm flying to Trinidad, so I will not be here. So I have to move it to June. So we'll have to meet up because we couldn't do it before that because it's graduation at Downstate Hospital. So the auditorium is taken, they're utilizing the auditorium during that time. So most likely we are looking at the first week of June, the week of the 3rd in June, but I will come back with more information on that. I will put it in the chat anyway so that and ask Zorian to put it in the chat to send to each person. I have to confirm it with Downstate, make sure. And if we are not able to use Downstate, then I will have to ask for permission to use the T building at Kings County. So just give me a week or so until, because everything is so hot at Downstate Hospital now, so it is so hard to really get information pertaining to this right now. But the committee is still going. Dorian, do you remember as to which day this month the committee was supposed to be meeting?
Which month? Sorry, come again?
Do you remember which day this month? Is it next Wednesday? They have the mental health committee we're supposed to be meeting. Is it next Wednesday?
Yeah, I think it's the second week in every month. So
okay, so therefore we'll be meeting on the 13th. The 13th we'll be meeting. Yeah. So the areas we are looking at, because we have already established that we're looking to have 3 sessions, but we have in that first session, and then we already established the next session will be for the youth in September. So in between there, we're looking to see if we want to do one in between or after. And then also we're looking for the panel, to have persons, we have social workers who one person will be from Kings County Hospital. We have, I know Dorian is working, she was still trying to get the full logistics as to where we are going with the forum, what the point of discussion would be, so she can get someone from Department of Health to be one of our panelists. We also have a social worker from, he was with us last year, he was very good. And I think he will more or less be touching on mental health on men. And one person already, that was very interesting, Sam, because the person said, are you doing anything for men when it comes to mental health for men? And then also, we have one of the pastors who there with us, who is really focusing on in the faith community, that pastors, they have a lot of issues for themselves, and then also the leadership of the church, because everybody goes to them, but who do they go to? And they themselves need persons that they can talk to. So it is just a broad wave of discussion when it comes to mental health. And one of the areas we're also looking at, what we're looking at is the wording of the flyer that we want. When we put the flyer together, when it's sent, we put out the flyer, we want persons not shying away, we are not wanting to come, but we want persons to come and want to be part of the conversation, because the conversation shouldn't be a conversation that the panelists are just sitting there and just talking and people are just sitting listening. We want to have dialogue together. We want persons to be able to ask questions, to participate in the conversation. Because most of the time when we go out there and we're going to a forum or there's a symposium or whatever, they have a panelist and they're just doing all the talking, and it's okay, I'll take 2 questions and I'll take 3 questions. But we want persons to be able to ask questions and be able to right through the program, because it will be from 11 to 3. So person will be coming, we'll have lunch, and then we are bringing the issues on the table in the morning, and in the afternoon time, we are bringing solutions. Because all the time, we always have a whole lot of discussions as to, this is the problem we have, this person is doing this, and this is happening, and this is happening, and we have all these complaints and all the happenings, but there are no solutions that are brought to the table, and we want solutions as to where we go from there. This is what's it impacting our communities, what is impacting our schools, what's impacting our homes, right? But what are we going to do? Where do we go from there? So we need solutions, So that's where we are. So if anybody have any great idea when it comes to, I think Dorian did come up with a theme that we should have a heading for the flyer. But if anyone has any, any great ideas to the wording of the flyer, just to capture persons wanting to come, wanting to hear, wanting to be part of, I'm really looking for that forward. Okay.
Yeah, I think we were trying to still come up with a name for the series of mental health discussions. Maybe like something like community chat, something like it didn't seem to, I don't know, the title wasn't like heavy and like mental health, but just more, I don't know, something that wouldn't keep people away, would seem inviting. And I know there's a lot of stigma around like mental health. So
yeah, we don't want to use the word
scare
mental health
people.
at all.
Yes, things that didn't like scare people away. So
Mm-hmm.
something around like maybe community conversations about mental health, something. Yeah, I don't know. I've been brainstorming, but if others have
Yeah.
ideas, we'd
Well,
love
I'm really
to.
looking.
What about
I don't want
wellness?
Huh?
What about wellness?
Mhm.
Community wellness? I don't know.
Mhm.
That's a
Like,
positive. It's a positive.
yeah,
Yeah.
no, that's good. I like wellness.
Mm-hmm. Yeah. I was thinking of getting your mind right.
That's cute.
So we'll see where we go from there. I have two meetings at 8 o'clock. I don't know how I'm doing it. You realize I just got here and I just came right on. And I have two meetings at 8 o'clock. Never stops for me. But
Wow.
Darian, I thank you for just holding on, leading out in the meeting. Miss Ellington, thank you so much for being here, and hoping that you'll continue to be here with us and be part of the conversation, and whatever ideas that you have, and each person who is here right now. I know I heard from Enid, she has a really bad cold, so she was not able to be here. But your opinions, your ideas, whatever that you bring to the table is much valuable to the committee. So bring it, let's discuss, let's make it happen. And then also we are not forgetting our seniors. So I'm still looking for us to do a senior spa day this year again. And hopefully last year when we did it, it was very, so there are two things I'm looking to do. The seniors party, and then the looking to do, how would I call it? But I want us to take the seniors out. I want to take the seniors out to a Broadway show and lunch afterwards. So it's either or. Either we do a wellness. I know they really enjoyed the wellness, and last year they said to me, "Are you gonna do this next month?" I'm like, "It takes money." So they were really looking forward to it because they had pedicure and manicure, massaging, they had their hair done, they had a movie, they had bingo, they got prizes, they got the works, so they really enjoyed it.
Can I,
They did,
go ahead, I'll let you finish.
No, you go ahead.
Yeah, I
Miss
wanted to
Ellington.
just ask a question because I do recall on one of the meetings that you had I think it was last month, you were talking about like a mental health initiative coming up. Can you just briefly touch on exactly what like we're looking to achieve with this initiative?
That's what I just discussed that.
Right.
Yeah, that's what I was just talking about.
Yeah, I heard you mention it. Like I heard,
Yeah,
we're
so we have much happening in our communities. And then I think that especially in the Black and Brown communities, when it comes to mental health, no one really wants to face it.
right.
There's an issue. We have our children, especially young children. And my thing is that when you have an 11-year-old child who commits suicide, something is wrong, and then persons kind of like, oh, where maybe they were just bullying. But what does bullying contributes to, right?
Right.
Then you have persons who are going through trauma at home. You have women who are going through domestic violence at home. You have a maternal health that is happening in our healthcare. There are so many different things that attributes to mental health. But persons think that mental health is just that somebody get up and then they're crazy and they're just going on a rampage. But there are so many different things that happens. And then when it comes to young people, we want parents to be able to, because my thing, I was more or less looking at young people. But then when I spoke to one of the persons at Congresswoman Clark's office, he was just writing it for me and say, hey, let's take it to a different level, right? Because I'm like, and even assembly, I have to go, it's 8:02. I'm concerned member Rita Joseph, she's like, Miss Leopold, do you know as to how many students who kill themselves in Manhattan and we don't even hear about it? They go on the building and they jump down and it's not even in the media, you hear nothing about it. And when it comes to the schools, mental health is an issue in these schools and the kids are having a lot of issues. So we have kids who are failing, and then because of the shame that they want to bring to the parents, they kill themselves. There's so much. And then you have a child coming into your house and you know that this child is vibrant, like to talk, like to go outside, watch TV, play games. And all of a sudden, this child is withdrawn. This child is not interested in this and not interested in that anymore. But parents are not paying attention to those things until it's too late. And when you have a child and you walk into your child room, this child have withdrawn. This child is going for some mental health issue. You're not paying attention to that. And then because you feel you don't want anybody to label your child as somebody with some mental health or however that they want to some mental issue. So you're not seeking medical help for this child, and then the child commits suicide, or else then the child go to school and then start harming people in school or doing different stuff. And then you, that parent, walk into a room and find that your child commits suicide in the room. It affects you until it
Well,
never goes away.
the reason I ask that is because I want to see how I can best add value, right? That's why I've been joining these meetings and listening in on these meetings, because I do a lot of work in the healthcare and public health space. I'm an advocate for trauma-informed care across New York City, because I do feel like that's one of the main things that New York City's, especially healthcare system, is truly lacking. A system that is trauma-informed and ACEs, or adverse childhood experiences. So, just talking about what parents need and what they need to know, we need for parents to essentially be trauma-informed, because the thing about the Black community, right? I'm a Black woman. I'm a survivor of trauma. What we identify as trauma in our community is everyday life. You understand? We don't consider it trauma. And so how do we help the community understand the neuroscience of the brain and how trauma works? How do we help our schools become trauma-informed? How do we help our healthcare systems become trauma-informed? Adverse childhood experiences, or rather ACEs, is linked to 9 out of 10 of the leading causes of death in the United States, including suicide. The second leading cause of death in youth ages 15 through 24. ACEs is linked to things like heart disease, cancer, obesity, and more. However, a huge portion of our clinicians have never even heard of ACEs. The ACE study was something that was conducted in the mid-1990s by two clinicians from the CDC and Kaiser Permanente. And it was a huge study that many public health professionals consider to be the elephant in the room. It's the topic that nobody wants to talk about, And so I think that that is something that our community is missing. You know, ACEs is very linked, has been proven to be linked to gun violence, something that I know the Crown Heights community has been struggling with since the beginning of time, you know, or even the historical or intergenerational trauma that I know is very prominent on my side of Crown Heights, on the Utica and Schenectady side, where we're still living with the, I guess you can say, just the spirit of the Crown Heights riot, where I just feel like nobody wants to talk about it, but it's still affecting us.
Yeah.
You know, and so, yeah, I think that that is just a good place to start. Like, I sit in on a lot of calls across New York State to kind of listen for this. What is the trauma-informed initiatives happening? Because there's so many other states that are literally pioneering and championing this. You know, California, Chicago, Florida, they have amazing trauma-informed and ACEs initiatives where doctors are now being screened and are incentivized for screening for things like ACEs. But in New York City, our doctors still don't even, they never even heard of it. And teachers
Yeah.
also. So that's just one thing that I can think of, maybe possibly doing.
So if you can just put in your telephone, the chat for me, if you don't mind, I'll be very happy, because I would really like you to be at our next meeting. I would like you to be part of that panel of the discussion. That would be great. You know, and talking about that, when you look in during COVID, we didn't hear about it. So many people committed suicide in COVID, and a lot of young people. You know why? Because a lot of young children, both boys and girls, were sexually molested at home. Whole lot of them. And what is being done about it? And those who are survivors, those who were strong enough to withstand the trauma at home, they're still traumatized. So sometimes you have kids, they're going to school, and then they're behaving in certain ways in school, and certain things that are happening, and people are wondering, why are they behaving this way? Because he's bad behaving and she is this, and it is so much aggression and so much pain and so much hurt, you know. And then and as you said, and I'm saying, parents need to see. And some parents, they do know, but they just took it and they just sweep it under the carpet, you know. And then we have to save our communities. And in order for us to save our communities, we need to save our children. We need to save our young men. We need to save our mothers. And we need to save our women. And we need to save our men. Because everyone may not have the same issue or level of issue, but a lot of persons there, about 90% of our community are traumatized with something, financial, whatever, you know. So when we were going, I'm coming from the Caribbean, and somebody start acting irrational and say, oh, don't worry about him, he's crazy, you know, and they just let them go, and, you know, and the issue just started getting worse, and they start behaving worse, you know. So we're just hearing persons doing this on the subway, and persons are afraid to go on the subway and taking the bus or walk on the street. There's just so much happening. And then one of the areas that I'm looking for us to have more discussion on mental health at the schools. You know, we need to go to the schools and target those parents, because when you invite a parent to a conversation, if you send out 200 invites, and you may get 200 responses that they will be there, the day of when the 10th person shows up. You know, so I'm really looking for us to be able to penetrate the schools and go to the PTAs, you know, and then have dialogues and meet the children sideway, and have, you know, sidebars with the children and talk to them, because sometimes, most of the time, children, they don't open up if their parents are there. So as long as they get it okay, and we're able to just have a discussion, we're not going to, we don't want to go in to question children, but just to talk to them, let them know there are people that you can talk to. You know, sometimes, because sometimes they don't even trust the guidance counselor in school, you know, but there are other persons that they can call. There are other avenues that they can go to, other channels that you can reach out to be able to talk. Yeah, so, oh, did you put in your number for me already, Miss Ellington?
Yes, I'm sending it now.
Okay. I appreciate it, and I appreciate every person's who is there, who stayed on. that you guys will have you know, be able to, so when the flyers are ready, flyers will be out there, and then to have persons to be there. We want persons. I know we want it to be hybrid, but I like persons to be there, to see faces, to have a conversation. Wonderful. Dorian, are you saying the notice?
Yeah, thank you. Thank you, Brittany. Yeah, Brittany, if you could join those planning meetings for these mental health sessions, that'd be really great. We'd love to have your
Yes,
input.
definitely.
Because we are still discussing different topics. And yeah, we do want to cover, like, we're thinking for the first session, perhaps just covering destigmatizing mental health and how to talk to each other, your loved ones, family members, friends, colleagues about mental health. And also would like these mental health sessions to just be a place for like resource sharing, knowing about trauma-informed care, how to recognize signs of suicide to help someone in need. Also, something else we discussed was secondary trauma and how it impacts particularly the ones that are providing support. So like the mental health therapists, the social workers, the trauma that they experience from serving individuals or people in the community and taking on some of the weight of their stories of trauma, and how that impacts their mental health. And of course, covering youth mental health, specifically, like some things that I was thinking about was the impact of social media and how that impacts or affects a teen's mental health and how they feel about themselves, and how it's linked to depression and possible suicide. So yeah, just some of the things that we discuss in those planning meetings. So we'd love to have you join.
So when it comes to the September, where we'll be solely dealing with the youth, we would really like you to have a voice in leading out in that discussion. That would be great. Okay, any more questions, any comment from anyone before we depart? I'm late for my other meetings. It's already 8:14. But this is great discussion, so I didn't want to just end it abruptly. It's very important. So we don't have any more comments or any questions. I want to just say thank you so much for your patience, for your comments, and just being here every month, and just bringing much information. And I'm so happy with Miss Ellington, who is here now, and just letting her know that's the reason I like when we are able to introduce ourselves, because we don't know who is there, and what they really bring to the table. So, Mr. Perkins, I'm looking forward to hearing from you, and you being part of the conversation. And Anna is always, I know the work that you and your organization are doing is just so meaningful for the community. And Natasha, Darian, thank you so much, everyone. Thank you for being here. Thank you, Mia, for just opening up the dialogue. And have a good night, everyone.
Can I just say
Yes,
something?
go ahead. Sure.
So yeah, I'm working through the kinks of the WhatsApp Brooklyn CB9 chat that we have. So I know I'm like been able to slowly add people to it, because I think I figured out some of the issues that I've been having with doing that. But if you did get an invitation, can you just introduce yourself, your name, just so we know who you are, and we can just continue dialogue in that chat about like sharing different resources in the community, and yeah, whatever we want to discuss or bring to this meeting every month, whatever topics. So and if I haven't added you, you can just send your phone number to Mia or to the main CB9 email.
Yeah, so we have the WhatsApp group. We really want persons to be part of that WhatsApp group, so we can, even during the month, before we meet, anyone have a question, comments, any concerns, anything, that they want to share with the group, that you will be able to send it to the group. So if you can just send your info to me, and then Mia then will pass it over to Darian, and then she will update. Then you'll see you're added on to okay. So far, how many persons do we have on the group right now? So we have myself, Darian, who is New York, NY.
It's 5 members.
It's Nyasha. I don't know why it's Nye for short, and it's just
Oh,
happens to be New
Nyasha,
York.
okay.
Yes,
And I
but
think
I
the
just
other one,
sent
I
I
think
just
is,
dropped a message in the group.
Yeah,
Dorian, is that the right group? I just
yeah,
want to make sure.
this is the
Okay.
right one. Yeah, because I had 2
Okay.
different ones going on, but this is the right one. Yeah, thank you.
I felt so left out between like the months. I'm like, are we updated on, are we planning something? I don't know. So usually when I come home, I was like, oh my God, what did I miss? So I'm glad to be a part of the group now, and I can see things actively as we're going through it. Great.
Yeah, thank you.
And the 9172, it is who?
That's
That's
me.
you. So you can
Yeah.
change, if you can put his name there, so we know that it's just it's
Yeah, I
Mr.
do see
Perkins.
I have Justin and I have Paul and I have you, Francesca, and then myself, of course.
Yeah, but Justin name is just there. He doesn't have a name. I don't know if we can rename it, if we can put his name.
No, you won't be able to rename people in the group unless
Okay,
they
so he
have a
will,
name there.
unless, okay.
Yeah.
So yeah. So I'm assuming if Miss Ellington wants her name in there also, so she can send. Well, if you look in there, you see her telephone number, so you can add her to the group.
If that's okay.
Darian.
If that's okay.
Thank you.
Skeleton. Okay.
And Anna, because I know,
Yeah,
and then you can
that's
add
me.
Enid also, because Enid is not there. Enid is part of the group. So if you don't have her number, I can send you her number, and I will Anna, the number your I think I have your cell number, right?
Yes, I put it in
Okay.
the chat
Well, Anna sent her number to you as well.
Thank
under
you.
Brittany's.
All
Yeah.
right.
Okay. All right. Wonderful. Great.
Thank you.
We are cooking with grass. Yeah. Okay. Wonderful. All right. So good night, everyone.
night,
Enjoy your
everyone.
Friday and have a great weekend. And we shall see you again. In between, we can touch base with each other in the group as we go along. Okay. Have a good night,
Yes.
everyone, and be
Good
safe.
night.
Thanks so
Thank
much
you.
for your contribution.
Thank you
Okay.
so much. Have a good month.
Okay, you're welcome. Good night, Mia. Thank you. Good night.
Good night.